Raising a child with a chronic illness is challenging, and one Atlanta couple says the battle over their young son's drug coverage has made their situation even more stressful.
Yeah, the Worledges spent a year trying to find a drug for their son Brannon, and then 6 months after they found a medication that worked, their insurance company notified them they'd have to go back to square one and start over. The Fox Medical Team's Beth Galvin is here to explain why that is.
And Sine and Tom, this is a pretty frustrating situation. Understandably, the family got a crash course in something called step therapy last year. It's also known as fail first. And to save money, insurance companies require patients to try a series of less expensive drugs before they can move on to more costly ones. But what if that expensive drug is the only one that really works for your child? What then? At 6, Brannon Worledge has grown up with painful ulcerative colitis, with his parents helplessly watching on.
It's extraordinarily difficult to not be able to just fix it.
For nearly a year, Brannon's mother says they tried several different colitis medications and dietary changes, but nothing helped.
He had excruciating pain, he had an inability to eat, he lost his appetite.
Then in November of 2016, Brannon's doctor prescribed a colitis drug his parents now call their miracle pill.
He got his appetite back, he started growing again and gaining weight.
But after about 6 months on that medication, the family got a letter from Aetna, their insurance provider, notifying them of changes to their prescription coverage. Under a cost-saving measure known as step therapy, Brannon would have to try one or more preferred medications from a list before he could step up to the one he was taking. The problem? Melissa Worledge says he had already tried and failed several of them.
And had very significant side effects, like vomiting up to 8 hours a day, extreme pain, fever, rashes.
The Worledges appealed Aetna's decision and were denied. And stories like theirs have led State Representative Sharon Cooper to propose a bill setting clear guidelines for when a company's step therapy protocol should be overridden.
If the drug is going to be counterindicated for the patient, if the patient has already failed on a drug, even if it was with another insurance company, if they failed on the drug before and they've had to switch insurances, they shouldn't be made to fail again.
After their denial, the Worledges applied for and were granted a 12-month step therapy exemption from Aetna. This bill would narrow the window that insurance companies have to make a decision on exemptions to 24 hours for urgent cases, 2 business days for non-urgent ones. Brannon has 6 months left before his parents will have to reapply for another exemption or find a way to pay the thousands for him to stay on this drug.
We're watching our child thrive, and the idea that that could be taken away from him is extremely unsettling.
And we reached out to the Georgia Association of Health Plans. It's a trade group that represents, among other insurers, Blue Cross Blue Shield, Cigna, Aetna, Coventry, Kaiser Permanente, and United Healthcare. The group's spokesman says it is not taking a position on this step therapy bill that now moves on to the Georgia Senate. Tom and Sine.
That seems like it's got to be so frustrating. I'm wondering if they do pay out of pocket, how much are they looking at?
So they're looking at a lot of money. They didn't, for privacy reasons, want to talk about what specifically the drug is or what specifically they might have to pay, but it's a lot of money and it's not something that they can do because they've been paying for years on their insurance plan, you know, so this would be in addition to that.
Yeah, we're talking about thousands of dollars.
Yeah, we're talking about thousands of dollars.
Good, they have the attention of state lawmakers, though, in this case. Beth, thanks.
Thanks.